After a spike in cases in Delhi and Bombay over the course of the last few days, there's been a lot of speculation about the possibility of community transmission. The Delhi Health Minister said that the source of over 50% of infections in the national capital is not known, hinting at the possibility of community transmission. But he also said that it was the prerogative of the central government, of the health ministry, to declare it. The ICMR today has clarified that there is no community transmission in India. India is not in the stage of community transmission. Now, community transmission, or stage 3 of a pandemic, is marked by cases that cannot be traced back to any source of infection. The government today has released the Sero survey report. Now, this is a report that talks about the prevalence of COVID-19, and the report says that less than 1% of our population has been infected. This was based on a survey that was carried out in 83 districts, and it says that only 0.73% of our population has shown the prevalence of the virus. So the government claims that the lockdown was a success in checking the rapid spread of the virus, but has also maintained that curbs need to stay in place as the population is still susceptible. We have a panel of expert doctors who are going to join us and break this down for us. But first, let's listen in to what the government said.
We found that about 0.73% of the population in these districts showed a prevalence of past exposure to SARS-CoV-2 infection. This means that the lockdown and the containment measures have been successful in keeping it low and preventing rapid spread of this disease over the last 3 months as we speak. However, it means that a large proportion of the population is still susceptible. The local lockdown measures need to continue as advised by the Government of India, particularly in those containment areas, and they have been successful up till now in containing them. We are definitely, India is not in community transmission, and I would like to emphasize it is not in community transmission.
All right, joining us this evening, Dr. Rippen Gupta. He's an interventional cardiologist at Max Healthcare. We also have Dr. Om Srivastav. He is a consultant infectious diseases at the Jaslok Hospital. Dr. Srivastav, if I can begin by asking you, break it down for our viewers. You know, what is a Sero survey and how encouraged or happy should we feel that it reveals that the rate of infection in India is less than 1%?
So the principle of a Sero survey is to find out how many people in a community are actually going to be showing that they have or they haven't got a certain infection, in this case COVID. There is a test to do that. You are able to do that through, well, a couple of technologies, but basically it's a test to find out if you are having the serum in the antibodies in your serum of this kind of an infection. If this Sero survey indicates, as the ICMR has already explained, if the Sero survey indicates that the rate of transmission and not the Sero prevalence, two different concepts, if the rate of transmission is less than 1%, then the lockdown has been appropriately timed, and appropriately, well, successful. But this is still early days. We are still not past the peak of the infection, and we are going to be needing to see as to what should be happening from here for say another maybe 4 weeks time.
Right. You know, before we analyze the findings of the survey and delve a little more into the details, Dr. Gupta, if I could bring you into the conversation, you know, clarify it for our viewers. What kind of a test is done? We're given to understand it's a blood test that is done, you know, to gauge antibodies. This is not the COVID test that is conducted, and it's a random sample, if we understand it correctly. Could you explain to our viewers what kind of a test is done in the Sero survey?
You see, this is looking for any past infection of COVID. So what we do is we draw a sample, blood sample, and we check for, it is by ELISA test, which is done for other infections also, and we see whether the person has those IgG antibodies inside. Now, if the IgG antibodies are present inside, that means the person has a past infection of COVID. So it is looking for a transmission of the infection in the general population. So if the number in this survey have been very high, 5, 10 or 15%, then we would have been worried, because then it is that India is in a community transmission phase. Because the number is very low, that means that at least the containment, as the government is also saying, has been successful, and the numbers are contain, but that means that we have to prevent going into the community stage. So hotspots, areas which have a lot of infection, should be, I think, put under lockdown, or we should do a containment in those areas so that they don't spread the infection to other populations.
You know, it's very interesting that you say that, because the report actually suggests that the infection in containment zones is high, but with significant variations across containment zones. You know, the survey has even estimated that up to 30% people could be infected or could have contracted the coronavirus in containment zones. And of course, there's again, you know, a very classic rural-urban divide there as well. Let me just bring back Dr. Srivastava, if I can, into the conversation. What do you make of this rural-urban divide? The report has suggested that rural India is much better off as compared to urban India, especially urban slums.
Yes, that's true. I think that there are multiple factors involved in this kind of a outcome in a survey. It's got to do not only with social distancing, it's got to do with the kind of habits that, you know, people practice in a society. It's also got to do with the kind of exposures that people have. Yes. Can you hear me?
Yes, Dr. Srivastava, we can hear you. Go on.
Can you hear me?
Yes, we can hear you. Dr. Srivastava, can you hear us? All right, we'll try and get that line back with Dr. Srivastava in just a bit. But Dr. Gupta, if I could bring you back into the conversation. Mumbai, Pune, Ahmedabad, Delhi have the high prevalence rate. This is what the report has said. There's relatively less prevalence of the infection in rural areas. What does this mean? I mean, essentially, living in a city is a punishment. Is that what the report is trying to tell us? What can we as city dwellers do? What would you recommend to our viewers?
You see, basically the social distancing which we advocate is difficult to maintain in a city. So clearly the spread of infection will be high. Second, the infection came from China. So initially the spread was through travelers who have gone outside and came to India. So they were more urban patients. So clearly the spread of infection was in the urban area. So I think there are two factors playing here. One, the source of infection. Source of infection was not India. Source of infection was China and Europe.
Yes.
So I think we got infection mostly from those places. So travelers were mostly urban. So when they came to the cities, that spread the infection in the local areas first. Secondly, the spread of infection will be more when the people are crowded. So in slums, the infection will be more. So that is very clear. So that's why the urban-rural divide, which we are seeing right now. Secondly, the Sero survey part 1 has been released today. The Sero survey part 2, which has to look at the infection spread in containment area, is not released.
Yes.
That 30% spread which we are talking of is a speculation. That is not an official report. That is just our idea that
it's
this
what
could be there.
sources are telling us at the moment. Yes, that official. And it's
So
also important. It's also important for me to just note here, you know, for our viewers, that this is a survey based on the status that was prevailing in the country at the end of April. So this doesn't talk about May or the beginning of June, for instance. But Dr. Gupta, if I could just come back to the follow-up question, what can we living in urban India, where we know that the spread of the infection is much higher, what can we do? You know, apart from the basics of course, washing our hands, wearing a mask. I mean, as people step out, go back into office spaces, what would you recommend they do?
You see, we have to change our habits. Indians have a habit of crowding into each other. We don't have a concept of private space. So whenever we go out, if you go abroad, the people will maintain a distance between two persons. In India, that habit is not there. I think now we have to change our habit and try to maintain a distance from other persons so as to prevent the spread of infection. Because the survey which is coming today clearly tells us that we have to be very careful so that the infection doesn't go into community stage. So next 2-3 months are very crucial for us to maintain a social distance. When we go out, we should not go out for a routine visit. We should be going out only if it is absolutely necessary. And when in the workplace also, we should maintain a distance. Don't have a lunch together, which you used to have. And the normal tendency is to
yes.
Yeah, as a community, we tend to go. We are more, you can say.
And I think that's really important advice, Dr. Srivastava, because as you know, we get into unlock 1.0. People tend to believe that it's okay to step out because it's now allowed. But I think what needs to be stressed on is the fact that you must step out only if absolutely essential. What would you like to tell our viewers? You know, this Sero survey is encouraging in a certain sense because it's less than 1% of the population. But should we still feel encourage? Should we still feel scared? What would you like to tell our viewers, Dr. Srivastav?
So this is, look, at this point of time in the evaluation of the data, it is an encouraging data, of course. We also know that the numbers are nowhere close to being under control right now. Of course, the most important thing is to, we know that there are only 3 or 4 measures that you need to do to ensure that you don't get the infection yourself and you don't pass on the infection to somebody else, which is, as you already pointed out, you need to make sure that your hands are sanitized. You need to make sure that any surface that you are coming in touch with is also sanitized. You must wear a mask, because that is clear. Even if there are 2 people who are both infected, if both of them are wearing a mask, the chance of one passing the infection to a third person is less than 2%. So the presence of a mask, the presence of hand sanitizers, and social distancing, these are the only 3 things that have been shown to make a difference in transmission, whether it is community transmission or transmission from a person to the other. But look, I must emphasize here that it can't only be the responsibility of a government or a body. It must start from the individual. There's got to be some amount of responsibility that the individual should be able to show, both at individual level, at the level of the community, in your own housing building society, in your offices. Unless we are able to do that, I'm afraid I have to say that we're probably going to have a repeat of all the lessons that we should have learned in the first 1, 2, 3, 4 lockdowns.
It's very interesting. I think you raise a very important point there, and let me also bring in Dr. Chawla into the conversation. Dr. Rajesh Chawla is a pulmonologist at the Indraprasth Apollo Hospitals, joining us this evening. Appreciate you, doctor, for taking the time of day. Dr. Chawla, you're a pulmonologist, and here's a disease that's linked with a lot of respiratory symptoms. What do you tell your patients, especially those who are vulnerable? We know that there have been linkages, for instance, that have been made between air pollution levels and susceptibility to COVID. Now, the Sero survey that's been released says urban areas, are much more susceptible. The situation is a lot worse in urban areas. Rural pockets are better off. What do you make of the survey? And second part of my question, what would you like to tell viewers, basis this survey? What are the kind of precautions that should still be taken?
As it is that it has not reached the community level still. So we need to, as you were hearing, that you need to continue to take precautions, which we have been doing, and social distancing. The other thing is, which is very, very important. You are asking me as a pulmonologist, what do you tell your patients? When they call me to show me personally, the first thing I ask them, do you have fever? Because once they have fever, you should not allow them to come to your clinic. You should ask them first to get, because this is a time of pandemic. And I have seen half of them, when I tell them to get it tested, they come positive. So the precautions, we tell them all the precautions which you just have been hearing, social distancing. And I think the 2 most important things which are highlighted 100 of times is the hand washing and the mask. If these are followed, then you can keep it at a distance. But the way it is, how far we will be able to, the problem is that you have to have universal precaution. It is not that once you did it and the second time you don't. It has to be all the time. If you miss one time, and the other thing is, if you are talking to someone, you should make sure the other person is wearing mask, because you protect me, I protect you. As Dr. was just saying, that unless, if I'm talking to someone and the other person is not wearing a mask, I'm protecting him, but he's not protecting me.
Right.
It is very important. If somebody comes to talk to you, ask him, first go and wear a mask and then stand at a distance and talk.
All right. So you've given us a new motto. You protect me, I protect you. 2 individuals engaged in a conversation, irrespective of the 6 feet distance, must absolutely wear a mask. I think that's a very important point that you make. Dr. Rippen Gupta, let me come back to you, because you're a cardiologist. You deal also, with a disease that is rampant in India. How does dealing with heart problems, which have been so rampant in India, how has it become more complicated in a pandemic? Do you also advise your patients to get a test if they have a fever and they're coming to see you? How does it work? Because, there are people with very real conditions who continue to live their lives on a daily basis. What do you tell your patients?
You see, the universal advice which Dr. Chawla said is what we all follow. Problem comes in when a patient has a heart attack. So then we cannot wait too long. So then in the patient, because if we wait for all those things, then the patient can die in the interim. So in those cases, all of us wear a PP suit, and then we go and do open the artery, do an angiography, open the artery. But that is one which is a very risky thing, because you don't know the COVID test of this patient, because
Yes.
report will come after 12 hours. But we have to save the life of the patient, so we have to do that. In Italy, initially they were not aware of this thing, and they did primary angioplasty without wearing PP suits, and there were a lot of mortalities. In fact, out of 100 health workers who died, 22 were cardiologists in the initial phases in Italy.
Right.
But now we are much wiser, so we wear a PP suit, the whole staff, not
Right.
alone the doctor, the whole staff wears, and then we do the case in an emergency. If it's a routine case, we usually don't recommend elective cases now, but if this is a semi-emergency or emergency, then we manage, because cardiology cannot be left delayed. The patient cannot be delayed.
It's very interesting that you've talked about, the fact that it could take 12 hours as a conservative estimate to get a COVID report. Dr. Srivastav, if I can bring you in, you're a consultant with the Jaslok Hospital. We've just gotten a story from Mumbai a short while ago where major private labs have been told that they can't conduct tests for a period of 4 weeks as a punishment because it was taking too long for the reports to come out. What's your reaction to the story? We know major private labs in Mumbai, 3 of them, who were conducting over 1,000 tests a day in certain situations, have been penalized. And the penalty is that no tests for a period, of 4 weeks. Who loses in this situation?
The biggest loss comes to the common man, the person who is suffering, the person who needs it the most is the biggest loser in this kind of story. I don't think this is the time to reprimand and stop the service of a laboratory, because it is crucial. If you're looking at these many numbers, you need to know what is happening in the community. And therefore, if your target is, instead of say 50,000 tests, if your target is 1 lakh tests or 2 or 3 or 5 lakhs, whatever is the target that you're hoping to achieve, there must be a way around this kind of a thing where you continue the lab to function. You allow them to continue functioning, but you still put across your point of view. So I don't think that penalizing a lab completely to say, look, you can't work for 4 weeks is the answer. There must be a way in between. Of course, that would be left to the people who are implementing this kind of policy within the health providers, the platform. But I'm not sure if that is the most productive way to go about things.
Right, but as Dr. Srivastav, again, as someone who's an infectious disease expert, are you satisfied with the amount India is testing? Are you satisfied with the testing criteria? Do you think, that given we're touching almost 3 lakh cases, we would by the next week be the 4th worst affected country? We need to test more, and therefore we need to enable people to be able to walk in and get a test instead of, the complicated procedures that we have right now?
In fact, if you look at the last couple of months, the procedure has been simplified to a large extent, right? It used to be far more cumbersome and tedious, not any longer. However, having said that, it's still a little difficult for somebody who is suffering, somebody who's having symptoms, to have to fill out forms, or the doctor to fill out forms, and that for these people to wait for about 24 hours, 30 seconds to get the test. But I think that are we testing enough? Well, I don't think so. We should be testing a lot more.
Right.
We should be testing a lot more. And that's the only way to know as to who are the people. So, when you say a person has walked into your OPD or your hospital or anywhere else, if you don't test him and you let him go back to the community, then you're always going to be opening the possibility that this person is going to infect any number of people, because he doesn't know that he's shedding the virus. So not knowing is not the answer. You must know. What you plan to do about that is another story. That is the next step.
Okay,
but
so not knowing is not the answer. Dr. Chawla, what's your assessment? Do you believe, that at this stage we are doing enough? The government still says we're not in community transmission. We have over 2.8 lakh cases as of today. We've reported over 9,000 cases for 9 straight days. Daily 9,000 cases have been reported in India for 9 straight days. Do you believe we're doing enough? We're testing enough?
For a country like ours, as much we test, that is less. So, but I think we have improved enough, And if you see the 3 months ago and today, we have really improved. And I'm sure in the coming days, they are going to do tests more because we need more tests. This is definite. But I think as you were discussing, stopping a lab from performing, because they are under so much of pressure.
Yes.
The samples sent are too many than their capacity. And that's why they are late. They are sent samples from the government, from the private. And then that is the reason. It is not that the lab intentionally delay the report. And I think they should be asked about the reason of delay rather than reprimanded. And this.
All right, we seem to have lost that line with Dr. Chawla. Dr. Gupta, if I can give you, the last word on this, do you believe we're doing enough where we are as of now? Do you believe we're doing enough?
I think we should do better because India is now going to be a developed country. And the number of tests which were done right now is inadequate according to me because we are a big country. We have 140 crore population. Seeing the number of population, size of population, the test number is less. So
yes.
We should be doing more because if let's say a person knows that he is having a COVID infection, he will protect himself from other persons. Let's say I know that I am a COVID infection, I'll not go out because testing should be, I think, made more simpler. And for that to happen, we have to have more testing facilities. So I think the more labs should be involved in the testing phase, so that we can do more number of tests in a given day. I think that should be the way Korea did, more tests. I think the way
right.
Germany did, more tests. I think if we do more tests, we can prevent ourselves going into the community stage.
All right,
so
unanimous agreement there among the doctors that we need to test more. We need to make the testing procedure a lot simpler than what it is. Dr. Rippen Gupta, Dr. Rajesh Sharma and Dr. Om Srivastava, thank you so much for joining us this evening, and thank you for sparing the time of day, and most importantly, thank you for your service in the midst of this pandemic. That's all we have time for.